Hey, it's Avery. I'm going to teach you how to apply a chest seal to an open chest wound, sometimes called a sucking chest wound, and monitor its effectiveness. As part of a rapid casualty assessment, you would expose the casualty's chest and back to identify penetrating injuries like entry or exit wounds. Assess breathing and look and feel for any wounds by running both hands across the chest and back using a sweeping motion. If you find an open chest wound, or if the casualty is displaying signs or symptoms of a penetrating chest injury, such as sucking or hissing, when the casualty inhales, or if they have difficulty breathing, stop the evaluation and locate the nearest first aid kit. In the kit, you will find a chest seal, which is an air and watertight adhesive dressing. There are two types of chest seals, vented and non-vented. The Committee on Tactical Combat Casualty Care recommends using a vented chest seal if available. This type of seal has been demonstrated to reduce the chances of developing a pneumothorax, which is a collapsing lung. Open the chest seal packet and remove the chest seal and gauze. Using the gauze, quickly wipe away any dirt, blood, or other fluid from the injury site. Prepare the chest seal by peeling off the protective liner. Whether it's a vented or non-vented chest seal, they are applied the same way. You must center the chest seal over the hole and apply, placing the adhesive side down, pressing firmly to seal the wound. If the casualty is awake, have the casualty exhale or breathe out before application. At the end of their exhalation, apply the chest seal. Check the chest seal to ensure that it extends at least 2 inches beyond the wound edges in all directions. Ensure all edges of the chest seal are flat and stuck against the skin. If tape is available, tape down all 4 edges of the chest seal to the casualty's chest. Repeat these steps to seal any other open chest wounds on the exposed side. Then, roll the casualty onto the opposite side and visually inspect the other side of the chest and feel with your hands for any additional wounds. Apply a chest seal and tape, if available, to all 4 sides of any additional wounds. After applying a chest seal, you will need to place the casualty in an optimal position depending on other injuries they may have sustained. Place a casualty that is awake in either a sitting position or the recovery position, depending on which they tolerate better. Place an unconscious casualty in the recovery position. However, if you suspect a head, neck, or spine injury in a conscious or unconscious patient, leave them as you find them on a hard, flat surface. Reassess and monitor the casualty for breathing every few minutes. If the casualty becomes increasingly short of breath or has difficulty breathing, this could be a sign of a pneumothorax, which must be addressed immediately. To relieve pressure that builds up in this type of pneumothorax, you will need to burp the chest seal by lifting one edge of the seal up, allowing any trapped air to escape. Clear any blood away from the area and reapply the chest seal upon exhalation. Alternatively, remove the entire seal for a few seconds to decompress the wound and reapply it or replace it with a new chest seal. If a casualty's breathing continues to worsen despite burping the chest seal, notify medical personnel immediately. Document all medical aid rendered on the patient's DD 1380 Tactical Combat Casualty Care Tccc card if available. Inform medical personnel of your findings and any medical aid provided and assist with evacuation as requested. Applying a chest seal can help restore a casualty's ability to maintain adequate respiration and is a critical skill that is part of the MARCH airway and respiratory management techniques.